Age-related macular degeneration is a most common cause of visual loss in patients with age more than 50 years. Patients who are having a positive history or a hereditary history and who have a history of excessive smoking and who has a history of hypertension, who are having excess exposure to the ultraviolet rays are more prone to develop the age-related macular degeneration. Normally, the retina is made up of 10 layers. Out of this, the outer retinal layer consists of the rods and cones layers which sends the visual signals to the optic nerve, and behind the rods and cones there is a retinal pigment epithelial cells which will densely adhere to these rods and cones and which are useful in transferring the materials from the outer retinal cells to the choroid. The choroid complex is very important in supplying the blood supply and bringing the oxygen to these highly functional outer retinal cells. The choroid vasculature and the retinal tissue are separated by a membrane called Bruch's membrane. As the age increases and as these patients who are at risk of age-related macular degeneration, there are at risk of developing a choroidal neovascular membranes through the Bruch's membrane from the choroidal complex into the retinal pigment epithelial and outer inner retinal cells. The AMD is mainly divided into two types. One is a dry AMD which consists of a typical drusen with loss of rods and cones, retinal segment layers and the degeneration of the RPE cells. And another one is a wet AMD which is typically characterized by choroidal neovascular membrane complex. If it is a dry AMD, the patients are more likely, it's like 9 out of the 10 patients are having the dry AMD and the one patient of AMD will be of a wet AMD type. Once the patient is in the dry AMD, they are most likely put on the multivitamins, especially the retinal proteins like luteins, zeaxanthins, carotins, vitamin C, E and other components. A patient with wet AMD are very thoroughly treated with either laser photocoagulation, photodynamic therapy or intravitreal antivascular endothelial growth factors. A patient with vitreous hemorrhage or a breakthrough CNVM has to be treated surgically. So early treatment and diagnosis of the wet AMDs are of great concern here in order to prevent further progress loss of vision.